Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. Joining us today is Dr. Donald Schwab, a board-certified general surgeon with Terrebonne General Health System, Bayou Surgical Specialist, and Physicians Medical Center, along with his patient, Domingo Rodriguez, who is going to share his weight loss journey with you. So welcome to the show, gentlemen.
Thank you.
Dr. Schwab, let's get started with you saying a little bit, telling the audience a little bit more about yourself.
I'm from Houma, Louisiana, actually. Born in Metairie, but been in Houma since I was 4 years old, and went to high school here and ended up going to medical school in New Orleans, and did my residency up in Greenville, South Carolina, and been back in practice for almost 25 years with Bayou Surgical. Enjoy our practice, enjoy doing what we do.
Right. And Domingo, can you tell us more about yourself?
Yes, ma'am. My name is Domingo Rodriguez, Jr. I'm from Dominican Republic. I've lived pretty much all my life here in Kenner, Louisiana, where I went to school and graduated. Went to college at Nicholls State University. And currently I am a site leader at Dow Chemical and in St. Charles Parish. I have 3 beautiful children, wonderful family, and it was definitely an honor to be here, sitting here with y'all, and willing to share this journey story with y'all. For sure.
All right, well, great. Well, let's dive into today's topic, your weight loss journey. First, we'll start with Dr. Schwab. Can you tell us why you decided to get into bariatric surgery?
We, as a group of general surgeons back in the early 2000s, were looking at bariatric surgery as it became more popular from a surgical standpoint of looking into it. And we realized that there was really a need in the community. Our patients were having to leave to go to New Orleans, Baton Rouge, Lafayette, and we felt like, we were good laparoscopic surgeons. We were competent, and we knew how to take care of our patients, and we thought we needed to establish a program. So we established the bariatric program back in the mid 2000s, probably 2004, 2005.
And what type of surgery do you provide?
In our bariatric program now, it's kind of been a journey for us where we started off doing gastric bypasses, which at the time was the most popular, and then we went to the lap band, which we did for several years, and for about the past 10 years, we pretty much exclusively provide sleeve gastrectomy for our patients.
Okay, and that is considered the gold standard of bariatric surgery. Can you tell us more about that?
When you look at weight loss and sustained weight loss, the 2 surgeries that are the best are the gastric sleeve and the gastric bypass, certainly.
Can you kind of tell us why and what the differences are between those 3?
When you look at the gastric bypass surgery, there's 2 components to the weight loss. One is a restricted procedure. We make the stomach smaller so you can eat less, but we also reroute the intestines. And by rerouting the intestines, we cause malabsorption. So by causing malabsorption, you absorb less calories and you lose weight. The sleeve gastrectomy is a simpler concept, and I tell my patients all the time, it's kind of like if you would imagine taking your stomach is the size of a 2-liter bottle, and we make it a 10-ounce can. And you can put a lot less in that 10-ounce can than you can the 2-liter bottle, and less means less calories, and at the end of the day, less calories means weight loss. So the sleeve is strictly a restrictive operation. The advantage of the sleeve over the bypass is that it's safer, the recovery's better. There are other things that the bypass produces that the sleeve doesn't produce, side effect-wise, long-term. So it's really become the go-to bariatric operation really across the country.
Okay. And how do you determine who is a good candidate for this procedure?
Historically, we look at BMI, which is body mass index, which is a ratio of your height to weight. And certain BMIs, it initially was over 40 BMI, 35 BMI higher with some comorbid condition. But as we've learned more about weight loss and about being unhealthy, being overweight, the BMI is lowered now, so low 30s even considered patients with comorbid conditions are considered for surgery.
And is this a safe procedure, and is it covered by insurance?
Great question. Any surgical procedure that you have, the safety depends on who's the one doing it, right? And so we've been doing the sleeve specifically for, like I said, about 10 years. And I tell all my patients I'll be willing to we keep track of our patients, and we keep track of our complications, and we have a very, very low complication rate. And one of the things patients come in will say either they felt like the surgery was too dangerous, or the family thinks it's too dangerous. And in reality, being morbidly obese has a much higher risk of complications than having a sleeve gastrectomy. It's not even comparison. So in our program, I'd put our numbers up against anywhere in the country as far as our complication rates and how our patients do.
Right. I mean, just let's get into a little bit about obesity and what types of disease and problems are associated with that.
The big realization, and from a bariatric surgical standpoint and an obesity standpoint in general, has been the relation of the causation effect of, as the heavier you are, the more complicated comorbid conditions you have. So the higher the BMI, the obesity rate, the more comorbid conditions you have. That's bad news. The good news is that now we know over 40 years of studies that when you lose the weight, the comorbid conditions either go away completely or get better. High blood pressure, sleep apnea, reflux disease, diabetes, all these things are related to being overweight. And when you lose the weight, you get healthier. And that's really the critical thing. Losing weight is not about looking skinny or looking better. It's about being more healthy. And when you look at the statistics, it's pretty alarming. One of the statistics I always share is that if you take a 40-year-old who has a BMI over 50 or over 45 or over 40 for that matter, and you match him up with a 40-year-old whose BMI is normal, that 40-year-old with a BMI over 35 or 40 has a 66% chance less rate of living to 65 than the normal weight person. So we're talking about really impact on your longevity from that standpoint.
Right. So when you think about it like that, the benefits outweigh the risk.
No question. No question about it. No question. And it's kind of interesting because there's this big push for the injectables right now in the community. And one of the things I laugh at all the time is the Pfizer and Lilly are coming out with these studies, these revolutionary studies that say, ooh, the weight loss helps the cardiac performance. The weight loss helps the diabetes with the injectables. Well, we've been doing that for 50 years with bariatric surgery. It's nothing it's not some sort of epiphany that we didn't realize that weight loss results in that. It's just that now they're going to be able to say that because now they can push those drugs because they can say, oh, if you take the drugs, you'll have a better cardiac, your blood pressure will be better, your diabetes will be better. But we've been doing that forever with weight loss surgery.
Right. Domingo, let's bring you in. What was your health like prior to your surgery?
Prior to my surgery, my health, it was fairly well. And as I was getting older and not being as physical, and I will say that my health was starting to go down a little bit, high blood pressure, weight gain, pre-diabetic, so.
Were you on medications?
Yes, ma'am. I was on, actually, before my surgery, I was on 4 different types of blood pressure medications. Mm-hmm. And that was the biggest one, yeah. For sure. Yeah. Yeah.
Yeah. So what was your surgery and process like, and the recovery? How was that?
So surgery-wise, I was knocked out, so I don't know what happened.
Right.
No. But surgery-wise, getting prepared for it was amazing.
Right.
The doctor and his team, they made sure I was comfortable from the moment that I even started talking with them, right? And up to the surgery was great. Recovery was amazing. Recovery was, it's always in your mind, oh man, I'm gonna be down and this and that. Well, you know what? I was so excited. I mean, I can only speak for me. Mm-hmm. I was so excited that recovery was fine. I had been under a couple surgeries prior to this, not for bariatric, but yeah, it was actually good.
So how has your surgery affected your lifestyle now and your relationships with your family and friends?
So when it comes to affecting my lifestyle, it has made it a lot better, 100% for sure. I'm very, very active now, more active than what I was. Mm-hmm. When it comes to medicines, I'm no longer on blood pressure medication, which is amazing, right?
That was
one of the biggest reasons why I chose to do this. Well, we chose to do this was before my blood pressure and my health, and now after that, everything else is going great with it. Yeah, so it's been great. It's been amazing.
You mentioned there's a little bit of preparation before the surgery. What kind of lifestyle changes did you need to make before, and then what have you made after?
Right. So before surgery, before the procedure, there was a pre-op diet that I had to start. That I had to do 2 weeks prior to it, and I actually kind of started it a little bit before. I chose to make this decision during Thanksgiving, which is a time where, everybody wants to eat.
Everybody's indulging.
And I told the doctor, he's like, "You sure you want to do this?" I said, "Yes, sir. Let's go with it." And I kind of started it a little bit before, but it was a very strict diet, right? A lot of protein, based, and small meal, right, to get ready for the surgery, to make it comfortable for him, right? So I went with it and didn't have no problem at all.
So how much weight have you lost?
So my surgery date was December 4th of 2024 last year. and I was at 309, and I am currently at 198. So that's a total of what, 107 pounds, something like that. Yeah,
Over 100
Yeah,
pounds.
over 100 pounds.
That's
in 7 months.
incredible.
Healthy,
That's
healthy
incredible.
wise too. Nothing.
Yes.
No type of starving myself or nothing like that. I do very well eating. So yeah.
Right. So did you have any unexpected surprises during the recovery process and the weight loss journey?
Unexpected. The only thing unexpected that I've had during this surgery, after having the surgery, and then still now, I can't eat avocados anymore.
And you love
Growing
them.
up, I eat avocados every day. Literally, me and my family, me and my father more than anything, every day. And now I can't. I can't even eat it. So as soon as I eat it, it makes me nauseous, and I don't touch it. But
Well,
after that,
that's just one
everything
little
else,
thing.
That's just part of it. But everything else is
But
great. Yeah.
everything else.
else has been great. So.
Well, what advice would you give someone who is seeking to have this type of gastric sleeve surgery?
So the advice since my surgery, I think I've referred five patients to Doc. So
That's how happy you are with this.
That's how amazing it is. And these people are very close to me, right? These aren't people that I'm just, that I meet. I mean, my brother, he's going to be with Dr. on Monday. The 4th.
Oh,
so,
wonderful.
and then the other people, they're very close people to me. And yes, and I recommend it. The advice is if it's something that's even, if your doctor says, hey, look, we need to look into this, don't hesitate. Like he said, I was worse when being obese. I wasn't scared of the whatever could happen right now. So yeah, recommend it to anybody that needs it.
You
for sure.
recommend it?
Yes.
Well, great. I mean, you're looking really good,
Thank you very much.
I think it's a lot about attitude too. And
Oh
looks
yes,
like,
ma'am. Yes, ma'am. Yes,
you
you
know,
got to be
the
very
right
positive.
approach.
You have to be very positive, and without the good man upstairs and beautiful team of doctors and nurses that can help you do this. Oh yeah, no doubt about it. So,
And you got Dr. Schwab to thank. Dr.
yes,
Schwab, how
thank
does
you
it
very much.
feel to be able to
Thank you very much for sure.
to help people, to achieve their goals and to get healthier?
Yeah, we at the beginning, I know we all of our group that does this bariatric surgery, we definitely discounted the sheer reward that this journey would take for us, and it's turned out to be one of our favorite things, because giving people their lives back is literally something that is just, it's special, and the reason why you do things is because of that. And Domingo is a perfect representation. I mean, when he says he brings people, he doesn't just send people; he comes with them to the appointments and shows up with them, and he's there to support them. I mean, it's amazing. And a weight loss journey, a successful weight loss journey, is literally like giving someone their life back. And I tell the patients all the time that at the end of the day, we can do whatever we do, and we are good at what we do. But at the end of the day, the responsibility and the success is on the shoulders of the patients. And when they take it the right path and they choose the right things, by and large, our patients do tremendously well. And Domingo is one of many hundreds and hundreds and hundreds that we've got out there that have done it.
Well, there's nothing better than that. Success stories.
Yeah.
Thank you so much for both joining us today and
Yeah,
sharing
thank
your story with us.
Appreciate it. Thank you.
Appreciate you. Thank you. Thank you very much.
For more information about weight loss surgery, visit tghealthsystem.com. Thanks for joining us, and don't forget to like, share, and subscribe to our podcast where you get your podcast.